Okay, what does it mean by diabetes? Diabetes basically is high blood sugar in our blood. What is diabetes? Basically, diabetes is just too much sugar in our blood. Thus, we call it high blood sugar. Physiology of First, let's say this is your blood vessel, and here are some blood sugars. Sugars in our blood sugar. This is our pancreas, and pancreas creates insulin. And here is our body cells. This is the insulin receptor, which controls the glucose transporter, which is an enzyme on the cell membrane. So normally our blood sugar in our body should be between 4 to 6. A little bit higher, a little bit lower, that's fine. But between 4 and 6 are the optimal level. So when we eat, we absorb food, and then some of them will break down into simple sugar and we absorb them. This sugar will be absorbed into our blood cells, blood vessels, that may increase the blood sugar level. And when the blood sugar levels are increased, it will stimulate the pancreas to release more insulin into our blood vessel. And the insulin will be absorbed by the tissues utilized by the blood cells. So the insulin will bind to the insulin receptor on the cell membrane. They will stimulate and opens up the glucose transporter, which will have glucose influx into the body cells. That will decrease the blood sugar used by our body. What is type 1 diabetes? It's a type of diabetes that pancreas cannot make any insulin. The result is the glucose we absorb from our diet cannot be absorbed by the blood cells. The more blood sugars we have, the more starving our body cells become. And eventually, the body cells are so starving they will break down some new resources from within. That is, for example, fat tissues. So we break down fat stored in our body cells, and the byproduct from that metabolism of fat is ketone. So we have those toxic materials from our body build up in the cells, and eventually these toxic materials will be released into our blood. And in this kind of cases, our blood sugars are very high in those type 1 diabetes patients. And this condition is called diabetic ketoacidosis, which is a very severe life-threatening situation. To prevent 1 diabetes patients, what we have are something called insulin injection. So basically, you have a lot of sugars coming into our body, blood glucose level increases, and we will inject some artificial insulins into our body, absorbed into our blood vessels, and be used by our body. That will help to reduce the blood glucose level and preventing the starvation of our body cells. There is another problem, hypoglycemia. Hypoglycemia is a serious matter also because this is what will happen. So we have blood glucose absorbed into our blood vessels, and we inject a little bit too much insulin. So our blood glucose is almost about 6, but we injected more than what we need. The result is a lot. So we have a lot more stimulations on the blood glucose absorption into the body cells that will decrease the blood glucose very, very low into in our body. This is condition called hypoglycemia because we absorb too much sugar in our body. Diabetes, some of them do have insulin released. However, the insulin receptor in these patients are not functioning well. So only partial parts of the body cell receptors are able to open up the glucose transporter enzyme. That will lead to a lot of the glucose cannot be absorbed into our body properly. So that will have the blood glucose level remain high.